So the gentleman I am about to call to the microphone is the former president of the Medical Doctors Association and our shadow spokesperson on health and wellness, Dr. Alfred Dawes. Please make him welcome.
Madam Chair, a real setup. Prime Minister in waiting, Mark Golden. And I can't wait until I can drop the in waiting. Other panelists, members of the political directorate, business community, family and friends, good evening. This evening, I want you, or I dare you, to dream with me. I don't want you to think about the sorry state of healthcare today. I think enough has been said about it. What I want you to do is to dream with me so that we can all make it a reality. My vision and the party's vision for healthcare in Jamaica. We must first accept that health is a human right. As much as you can breathe, move around, love, take care of your families, it is your right. And it is a necessity for economic development because a healthy population is a wealthy population. Productivity is dependent on health. We take sick days and we spend money and we don't produce. And that affects the bottom line. And that is going to be one of the reasons why we cannot grow at the rate at which we want to grow if we allow healthcare to continue to decline in Jamaica. And as such, it is the prerogative of the government to keep its population healthy. We must have citizens protected from companies discharging harmful chemicals into rivers. The government must protect its citizens from water in their pipes that is contaminated by bacteria found in feces. It is the prerogative of the government to ensure that harmful chemicals and additives in foods are not in our foods in Jamaica. And of course, the ministry which I speak for in the shadow capacity, the Ministry of Health and Wellness, it is the priority of that ministry to prevent diseases, and when someone is sick, to expeditiously cure those diseases humanely and with dignity. It means that at every point of contact, there must be quality health care, and it must be delivered by staff who understand customer service in conditions that are conducive to you going to the hospital and getting better and feeling good. Not about waiting on the floor or being turned away because services are not available. And we must look at these points of contacts and how we are going to fix them. And let us start with emergency services. Here in St. Anne, I was surprised when I toured the hospital to find out that St. Anne's Bay is one of our major trauma centers in Jamaica. And it is simply because it is at the intersection of the North Coast Highway and the North-South Highway. So there are a lot of accidents coming in, and you have the hospital that is a referral center from as far east as Port Antonio, and because Cornwall Regional is non-functional, as far as St. James in some instances. Now, any emergency must be responded to by a dedicated emergency team. You must have a proper functioning ambulance service. And that proper functioning ambulance service must have trained emergency medical technicians, and they must have working ambulances that are not transport buses. And we will provide training and expansion of the EMT services that was conceptualized under the last PNP administration through the Fire Brigade Department and has since been gutted in the last 9 years. We will bring back emergency medical services, and we will expand it so that you will have proper ambulances outfitted with trained first responders. And that means when there's an accident, you won't see passers-by videotaping and pulling out people out of the wreck by their heads. We will stabilize patients and take them to different levels of trauma centers. And we will now look at how we're going to develop a comprehensive trauma center system across Jamaica, so that no matter where you are and you're in an accident, you will have quality health care just a few miles away. We are not reinventing the wheel. Trauma systems have existed from the 1800s, and it is just a matter of tailoring it for our population and our terrain. So you have different levels of trauma centers from level 1 to level 4, and it may simply mean that you stabilize a patient, that their airways, breathing, and heart are functioning, they're not losing blood, then they go on to an ambulance to another more sophisticated trauma center where they will have more investigations and a trauma team of surgeons with functional operating theaters, CT scans, MRIs as needed, so that they can be expeditiously treated. It means that when someone needs blood, we will not be having appeals on Facebook, but we will have a proper national blood banking services with blood available across the island. It means that our operating theaters will be outfitted. It means that if it requires airlifting, we will have proper arrangements with the JDF so that we will be able to stabilize and move patients in the golden hours, the first 6 hours after an accident, when survival rates are determined by how fast they can get specialized care. And it's not just for accidents. This is for strokes. We see 7,000 strokes every year. Many of them result in preventable deaths. 2,500 on average people die every year from a stroke. A lot of these are preventable. A lot of the paraplegia, the lack of, the inability to walk later on, are because you don't have a timely intervention to stop this emergency. We need to start looking at strokes as not just strokes. Just as we have a heart attack that you treat and reverse, a stroke is a brain attack that you can treat and reverse. So we will revamp emergency services. We will expand emergency departments to make them more comfortable, get them more well-staffed, and we will have our dedicated rooms to manage chest pain, trauma, asthma, etc. as needed. All of these blueprints already exist. It is just to tailor it. We are going to shift from infrastructural and grand project developments to focusing on the delivery of service. It is the role of the Ministry of Health to try and prevent diseases, and if we do have diseases, to catch them at an early enough stage where treatment is easier, cheaper, and more effective. Anybody who cannot cook like myself knows that you out the fire on the stove before it spreads to the kitchen. We have half of Jamaicans with diabetes not knowing that they're diabetic. 40% of hypertensives not knowing that they're hypertensive. We are seeing breast cancers being picked up in 90% of cases with a lump, which means that the ladies unfortunately have had that cancer for over a year. 70% to 75% of colon cancers are picked up when they are advanced, and the majority of prostate cancers when they have already spread. Any woman who gets cervical cancer in 2025 has been failed by the system because it is an entirely preventable disease with proper pap smear screening of the population. And so the People's National Government will prioritize prevention. It means national screening programs. And I saw during the party leader's speech when he spoke about rolling out national screening program, there was some scoffing from the other side to say that it already exists. And what that speaks to is a lack of understanding of what screening entails. Screening does not mean you go out on a road show and tell people that they should know their numbers. Screening means you have availability of the screening test and access to the screening test. So telling somebody they should check their sugar means nothing at all to a medical professional or that person if there's no way for them to check their sugar. So those programs that supposedly exist that are screening programs, they cannot work, and that is why chronic diseases are the #1 causes of death, #2, #3 in Jamaica. You cannot say that you have a national screening program when there are at most 2 mammograms across Jamaica in the public healthcare sector. That is not access. We need mammograms in every parish. We need to be screening for colon cancer, blood in the stool, and colonoscopies being available in every parish. Not the status quo where if you go to KPH, if the machine is working, you will get a date for 2027 for a colonoscopy if you are noticing signs of advanced disease. And that is why we are picking up cancers when they have spread. We will bring screening in a sustainable way to the people. And we're going to go back to basics. What we did in the 1970s with the community health aides, we're going to do it again. We combated communicable diseases, infectious diseases back then. We were one of the first countries in the Western Hemisphere to get rid of polio. We got rid of measles, rubella, malaria. We never fine-tuned and made that change to how we structured our public health system to face the growing threat of chronic non-communicable diseases, and that is what we're going to do now. The community health aides will be retrained and sent out with point-of-care machines so that they can do screenings themselves at churches, community events, schools, or even going into homes and checking to see what somebody's sugar has been like over the last 6 months. You don't have to be fasting. The technology exists where we can tell you then and there with a few drops of blood whether or not you're diabetic, how bad that diabetes is, whether you're pre-diabetic, and then we can make the necessary interventions so that you don't become diabetic or we get your diabetes under control before you have to seek health care at the hospital with a heart attack, kidney disease needing dialysis, or become one of the 15 people every month who get amputations. And that is how we plan to have a sustainable screening program. We will have mammograms, as I said, in every parish. We will have colonoscopy units. And I've spoken to some colleagues who have made submissions that were ignored about having training programs to increase the capacity of our local doctors to perform these life-saving procedures. We will work with those clinical professionals who are so eager to find the policymakers who support their dream of providing improved healthcare. But if you do get a disease, we want to make sure that the clinics are staffed. We want to make sure that you have access to that care. And I keep speaking about access because somebody thinks that if something is available, it is accessible. That is not true. There are social determinants of health. People cannot find bus fare and taxi fare to come. Sometimes people have to think about providing light at their home by paying bills versus buying medications for a disease that they're not feeling symptoms for. And these have to be taken into consideration. So when we speak about access, we are speaking about the ability to get healthcare that is close by, which means that the clinics, through telemedicine in rural areas or by the development of urgent care facilities, we will have access to healthcare when we need it without going to the hospital and overcrowding those hospitals.
Madam Chairperson, leader of the opposition and president of the People's National Party and the next Prime Minister of Jamaica, Mr. Mark Jefferson Golding. My colleague, panelists, and members of the shadow spokesperson team, the General Secretary, the man marshalling the People's National Party to victory. Candidates and standard bearers for the People's National Party in the parishes of St. Anne and Trelawney. Ladies and gentlemen, brothers and sisters, a pleasant good evening to you all. I am very happy to be here to participate in the first of a series dubbed the People's Forum. And it is very important for us to note and understand that we are starting off this series in three fundamental areas of life that touches on every single Jamaican citizens. And education, healthcare, and housing are all fundamental human rights. And it shows our value to these three areas. And so I am very joyful and happy to speak on the portfolio of housing and sustainable living, because I will tell you this, ladies and gentlemen, that 2 years ago, when I was called by my leader and he said to me that I'm going to assign you the portfolio of housing and sustainable living, I deemed it a joy because it was a shift from the traditional areas that have been assigned to me as a person with a disability. And what my leader was saying to me is that, look, I see your talent as much bigger than just dealing with disability issues. I want you to manage the housing portfolio. And as I contemplated the task that he gave me, I have to make reference to the fact that I originate from a community called Bailey's Vale in St. Mary, a rural community where my mother grew me up in a 4-bedroom house with 8 children. And then those children start to expand the family and we moved to 15. And because of the caring nature of my family, my mother, she took in community members so that they could have food to eat and a roof over their head, and it expanded to over 20. So I understand the importance of shelter to the people of Jamaica. And so when I stand up here to speak to you, I am one of you. And I couldn't be a party to a grouping that is going to come and sell the Jamaican people hollow. A real stuff we are going to deal with now. The truth is that from as far back as the 1950s, the People's National Party has established in its DNA housing. Norman Manley built Hope Pastures, Mona, and Harborview. And in the 1970s, having traveled Jamaica and seen our people living in bamboo houses, watland daub, and thatch houses, Michael Manley said that cannot continue, and he established the National Housing Trust, which to date have seen over 200,000 houses built in this country, changing the face of houses in Jamaica. And then in the 1990s, P.J. Patterson came with Operation Pride to provide land and housing for our people, and that is how people in Mount Edge come right in this constituency, get them houses. People in Bel Air in this constituency get their houses. And then in the mid-2000s, Portia Simpson Miller decided that her brothers and sisters must not continue to live in barracks houses. And so she tore down every one of them and built concrete houses for sugar workers across Jamaica. So it is in the DNA of the People's National Party to build quality and affordable houses. And so when my leader said to me, your mandate is to come up with a strategy to provide affordable houses to the people of Jamaica, I entered upon the reference and put together a task force that has worked with me to build out a number of strategies to ensure that we provide affordable houses to Jamaicans. To date, based on data, it is showing that there is a need for over 190,000 houses in Jamaica. And in order for us to keep up with the demand for houses, we have to be building 15,000 on an annual basis. The government of the day for the past 9 years have been building on average 2,300 houses per year. Last year, the NHT committed to build 15,009 houses to deliver to the market. They only delivered 2,754. If that is not a colossal failure, I don't know what else is. And so we have designed a number of strategies to tackle the housing crisis. And we were able to present to our leader so that he could go to Parliament and present in the budget presentation a clear vision as to how a People's National Party-led administration by Mark Jefferson Golding is going to start the housing revolution in Jamaica. And we have signaled the first thing we're going to be doing is to stop the annual extraction of $11.4 billion from the NHT to fund the national budget. What has happened over the past 13 years is that close to $150 billion of contributors' money have been used to fund the national budget. And we understand the circumstances. But my leader said time come. And based on that, and the fact that so much money has been spent to top up the national budget, your caring leader has said to the nation that we must give back to the contributors of the NHT because $150 billion of their money have been extracted from the trust. And so what we are going to be doing is that we are going to be building 50,000 low-income houses because the market has not been catering to these individuals who have contributed to the NHT over the years. And the leader has said, because of your money being used to top up the budget, we're not going to make you pay for the land portion of the housing cost when we build those houses. What that means is between $2.5 to $3 million savings for those individuals who will be purchasing their houses. And we're not gonna take back the land from the people. We're not gonna take back the land for the people. What that is going to do is immediately build up equity in the property that the individuals will get. That is what Mark Jefferson Golding is contemplating for the people of Jamaica. And he has not just stopped there. He has said to the country that young people must get the opportunity to own their own house. And I'm not going to give no idle promise to the young people like some people who promised to give 10,000 houses to young people and delivered not one. He has said that out of the $11.4 billion, we are going to set up a special fund with $1 billion annually and $500,000 each young person will get to pay the deposit on their houses across this country. As a grant. As a grant, you're not going to pay it back. But the leader and the team never stop there. We look around and we see the barbers. We see the farmers. We see the taxi men. We see the dressmakers and the bar owners. And we say, these people need to own a house too. But they can't own it because they're not getting a monthly pay slip. So what our leader said, rent to buy. We are going to allow a portion of these houses that we are going to build to go to rent to buy scheme so that the barber man, the taxi man, the dressmaker, the farmer can rent a unit. And when we see how they are paying for the houses, paying the rent, then we'll convert that rent into a mortgage so that these individuals can own their own house because the PNP believe that people must have them owner keys for them houses. We believe that it is better for you to own your owner key than to rent somebody's house, because when you pay a mortgage, you own your own key. When you pay rent, you borrow somebody's key. And then, you know, the General Secretary is here, and him know that me love to see a lot of things. And the leader has sent me across this country to visit those areas where you have had Operation Pride developments, to evaluate the situation where we are and where we need to go. And based on my visits right across this country, come back and make some recommendation to him. And coming out of that, we are going to establish the program for the orderly renewal and transformation of infrastructure in all areas, the P.O.R.T.I.A initiative that is going to see the tearing down of zinc fences, the building of sidewalks, and the handing over of titles to those communities and to those citizens who need to own the land that they are living on. I said to those individuals who are living in the 47 incomplete Operation Pride developments, if a Mark Jefferson Golding led PNP don't deal with those developments, nobody else will. Nobody else will. And so we are committed to ensuring that we complete those developments and restore dignity to the lives of people across this country. Let me tell you something. We're not even worrying about anything, because I have said to the leader, the 50,000 houses that we build, it's not we're giving them away. They are going to be sold to people across the country. And we expect to make a profit. And what we are going to do with the profit, some of the profit, is to fund that P.O.R.T.I.A initiative, because we believe that we must transform Jamaica and empower the people in their communities across this country. So if them want to know how we're going to fund them programs here, them can hug up that. And I say that since the leader have made these announcements, I have been inundated with calls from individuals across Jamaica, including representatives in different constituencies. The candidate for the PNP in Southwest St. Anna's called me, and she said that she wants to get the first housing development in Southwest St. Anne. And I said to her, don't you worry, Danishka, because help is on the way. We are going to be providing you with some of those low-income houses. And the member of parliament from South East St. Anne get jealous, and him have a councillor for the Beachertown development, Beachertown division, the Beachertown division, who join in with him. And I say, don't you worry, Dr. Russell. Help is on the way, because we are going to be providing you with some of the 50,000 houses in your constituency, P.O.R.T.I.A will be implemented the P.O.R.T.I.A area to complete that Operation P.O.R.T.I.A development. And if that wasn't enough, the Member of Parliament next for Northeast, St. Anne, Dr. Simpson, call me and him say, listen me here say everybody I get something. What happened to Northeast St. Anne? I said to him, don't you worry, because the people in Miami Bay will be taken care of, and the people out there in Pimento Walk will be taken care of as well.
Miami Bay and Pimento Walk.
And then the Member of Parliament in waiting for Northwest St. Anne, she called me and she said, remember, that is Morris, my name. Remember that I am your political daughter. What is in it for me? And I say to her, don't you worry, because we have identified the largest block of land on the North Coast, and you're gonna be getting a brand new community in Mount Edgecombe 5, and we're gonna be building a significant block of houses there that would ensure that hotel workers and the people of Northwest St. Anne can get quality housing.